Morning, friends. How are you doing today? I'm Dr. Hooker Echo, board certified pediatrician and CEO of Kids of Hope, a foster care organization that helps children who've been traumatized just boost their brain health so that they can thrive. And I have the amazing Dr. Shade Farri with us today, and we're going to be talking about how kids can breathe and thrive. So, without further ado, Dr. Shade, welcome to the show.
Thank you. Thank you.
So, please tell us all about yourself and how you came to do this amazing work that you're doing, helping kids in their communities breathe and thrive.
Thank you again, Dr. Echo, for having me. Um, I'm,
Pleasure.
I'm Shadi Fari. I'm pediatric pulmonologist, board certified pediatric pulmonologist. And so, all about me. I was born and raised in Nigeria. I knew while I was in medical school in Nigeria that I wanted to be a pediatrician. I've known that. And so, after moving to the United States and starting my residency in pediatrics, I quickly became drawn to something that to patients with asthma, with breathing problems. It's, as you know, it's something that's very common in pediatrics. And so, after my specialty, um, I've worked in many underserved communities. And one of the things that quickly came to bear is as much as I could help them within the walls of the hospital and in my office, um,
Right,
the, the factors that affected the asthma outcomes, a lot of it was out there in the community.
right,
There's so much about family life, socioeconomic status,
right,
education, access to resources, housing, right? That ultimately impacts how well these patients do. So
right.
it became my drive and my passion to help, not just confined to the walls of the hospital, and that's what brought about Kids Breathe and Thrive.
Right.
Our essentially formed around supporting community organizations, school districts, anyone who ever has a community organization that services kids. We're
Right.
able to support them in making high quality um, education, access to services available that then ultimately help kids and families with asthma achieve better outcomes.
Wow.
That's a lot.
That is wonderful. So, you may be asking why, why do we need to talk about asthma and why is asthma so important? So, can you tell us why it is so important, some of the statistics, and why this conversation is so important even in 2022?
Yeah, so that's exactly right. 1 in 7 kids in the United States has asthma. So this is
Right.
quite common.
Wow.
Um, and then 1 out of 5 pediatric visits to the emergency room is because of
Yes.
a breathing problem, right?
Right.
And unfortunately, as of now, there's also, if you look at race, if you look at socioeconomic status, those numbers are actually more. One out of
Right.
3 kids of color
Right.
have had a breathing problem or has asthma, and the outcomes, likelihood to visit emergency room, be in the hospital, is dependent on race, socioeconomic status, and by zip code.
Right.
So,
So we
sad.
have an epidemic basically.
Exactly. And it's been like this for decades, right?
Right.
And the sad thing is there's so much advancement in the medical field. We have so many much better meds in the last 2 decades,
Right.
meaning there's a lot going on. Science is
Hmm.
doing what it can, and clinicians are doing what we can,
Right.
but the outcomes are still significantly poor. So it's the important call to action, realizing that we can do what we can in the house of the hospital, but that if it's not enough, it's not enough. We have to
We
make sure
have
that where you spend most of your lives in the homes, in schools, in
right.
parks, that there's also access to kids there and to help them with asthma, which is chronic, so they deal with it not just periodically but all their lives.
Right. So basically, you're stepping out of the hospital to help the kids where they are, the kids and the parents, because we have to get to the parents to help the kid, right? So that's such important work. And did you hear those statistics? 1 in 3 children of color have breathing problems. And I know you mentioned several times, you said socioeconomic status and zip code and all of that. So let's talk about how experiences that children have in childhood, like adverse childhood experiences, how that can actually cause trauma, because there is research to show that that's actually the case, and why it's important for us to address the root cause and get to the bottom of this because of what the outcomes could be for your child.
Yes, exactly. So um, it's the numbers are also staggering if you look at certain early childhood experiences.
Right.
So children who are who have experienced family disruption, right, make a
Right.
large population of those within the patient populations that we see that have outcomes that have poor outcomes with asthma. So
Right.
in a lot of the communities we serve have a high have high numbers of children in foster care, have high numbers of children who in foster care have come to the emergency room because there was no family support or understanding. So
Right.
if some I've seen cases where a foster parent says, I'm in charge of this patient or this child, but I didn't know that they had asthma or what I'm
That's
supposed to
right.
do. I didn't know that and so emergency room visit, hospitalization, and many missed school days, poor
Right.
outcomes with education. So it becomes a cycle. So
Right.
that's one thing. Sometimes also it's the lack of resources. So there's also
Right.
lack of resources. Yes, I know there's asthma, but because of all that is going on,
Right.
that is not medical, but
Right.
maybe it's the depression, maybe it's like you said, the adverse,
Yes.
the traumas that they've experienced make it even difficult for them to deal with something as important as a breathing
Right.
problem because there's so much else to deal with.
Right, exactly. And they're when kids are exposed to trauma, their brains are already on overdrive, like with all the flooded with stress hormones. And so then when you have a breathing problem, your body is flooded with stress hormones. So now there's like this overload, and the only way out is actually it's not good, because unless we either decrease the stressors so that we can help this child breathe better, so that they don't become chronically sick, so that they don't have poor outcomes, like you said, start missing school, which of course will now lead to them not doing well in school, which of course will lead to homelessness or not even going to college or incarceration. So it's like this terrible cycle. So what you're doing is so important that we're getting to ground zero, basically. Let's come to you and where the children and the parents are, and let's talk about this, because the implications are so far reaching for in the life of the child, especially.
That's true. That's true.
Right.
The continuous cycle of the social determinants, the structural determinants about reaching are things that we don't take care of within the hospital. So reaching out
Right.
to organizations, to even I would say even foster care support systems, right?
Right.
To who already are then they're child serving organizations. So a
Right.
large number of children in their care will need this understanding. It's
Right.
primarily our work is centered around ensuring that the education is grounded in the understanding of what
Right.
asthma is as a chronic disease. Now, and
Right.
the next step is understanding the support systems, right, that exist in already in the society, but that many
Yeah.
of them are not aware of or don't take access, or don't have access to,
Right.
because they're not aware of it. And another thing we do is the making healthcare services more accessible to them. So
Right.
the things connecting them not just with social services, but some kids need specialist referral. Some kids need
Right.
further evaluation, making sure that they have access to that. And the third and the last part is also continuing education. There seems to be of the providers that interact with the families, and making sure that
Right.
everybody is on board, and then
Right.
breaking those barriers that make some societies or some communities less likely to trust um, systems that exist. So
Right.
education, support, and then ongoing training and expertise in dealing with hard to control asthma.
Yes. Wow. So that's, yeah. I mean, that just means we have a lot of work to do. I'm almost at a loss for words, but yes, that's what that means. That all of us, I mean, all of us, parents, foster care agencies, communities, just individuals, everybody has a part to play. Teachers. So how can teachers help? Like you say, you go to schools and work with the teachers. How can they help these kids? How can teachers be empowered to help their kids with asthma?
Good. That's actually a community that I've worked with in some places, and listening initially to their needs, to what they've experienced. And
Right.
teachers many times have been at the forefront of noticing that
Right.
a child is coughing more often. A child is less wants to be less likely to be active during recess. Kids love
Yeah.
and look forward to recess. You know how
Right.
many kids I tell, "What's your favorite subject?" when I see them, and
Recess. My
there's
kids
a
say that
recess. And I'm
too.
like,
I'm like,
no,
no.
not an option. So a
Right.
teacher noticing that a child doesn't want to do that.
Right.
At gym time, a child wanting to sit on the sideline rather than run laps in the gym, right? And
Right.
sometimes falling asleep during class, because all night they were up dealing with symptoms, right?
Right.
And then also knowing that children, not all children are quick to complain,
Mm-hmm.
and sadly also there's this population of children who have learned to live with these symptoms. They think that that's how, because I have asthma, or
Right.
they think that that's how they're supposed to feel. So
Right.
all those things many times teachers pick up on, and they see that, and
Right.
many times they are lost of how exactly can I help. So number one, some of our work has been with teachers, helping them first of all to understand, right, the how asthma many times can look in the classroom. That's number one. And then number
Right.
two, helping them understand and connect with already services. We strengthen school health services where they exist, and where they
Right.
don't, we've provided a quick and easy plan for schools and school districts to adapt, or early
Mm-hmm.
childhood centers to adapt. When you
Right.
notice this, what are you supposed to do? Many
Right.
times it involves directly giving them access to parents, or the care agencies, like foster care agencies that are in charge of
Right.
that child, but also helping them to know how and who to connect with um, in healthcare organizations. So in
Right.
some healthcare organizations where there's community health workers or social services, we've been a link between community health workers affiliated with an institution and
Right.
school. So that
Okay. Great.
that referral system is sort of like smooth, because if you say, here's a number, go call that number and make an appointment, you've just given that parent
Right. Right. Sorry
You've just
about
given
that.
that parent another task that to their list
Right.
of already. So that's recognizing symptoms, having access to link to notify that I've noticed things in classroom that seems like a sign that things are not going well, and then
Right.
working with their school health division and school district to have access. Another thing we've done with schools at large is advocate for policies, right,
Right.
that have been adopted in many states, but in some places are still lacking, like making sure schools stock albuterol, making sure that
Right.
nurses have the asthma action plan, which doubles as a prescription for them to give
Right.
medications. And then it essentially drives costs down, because
Mm-hmm.
if they don't have access to some of these things, immediately something is a child has a symptom, we're calling the emergency services, and that's an
Right.
ambulance trip to the emergency room. Things that sometimes early, if caught early, can be taken care of in
Right.
the school.
Right. Yeah, I agree. Yes, because that's a whole cost by itself. So that's wonderful. So that's for teachers. That's great. How do you empower? community services. So like places that have like boys and girls clubs and where children gather. How would you help strengthen their
Thank you.
capacity to help the
That,
children?
that's right. We've worked with community health organizations as community organizations like Boys and Girls Club as well to help them. So kids already gather there. They're spending a
Right,
lot of time there during the school years, during the summer, and the kids have come to know and trust these programs. So one of the
right,
things we've done is many of them have themes around either some health conditions. So some one of them, many of them have themes around encouraging physical activity,
right,
right? But if asthma has been a barrier, then a child is we know that children with asthma are less likely to participate in sports, even
right,
when they desired, or actually they have the tendency and the talents to excel in that sport, but they are
right,
less likely to enroll in trying out basketball. And so
right,
we've helped community organizations to organize education workshops for
right,
families. So they get to bring in the families. We can do
right,
one. We could talk through them with asthma education, with ongoing care, with
right.
access again to issues within the home. Another thing I think we'll get to shortly is um,
Yes.
the things that in the built and the physical environment, a lot of
Mm-hmm.
risks in homes where these kids are getting support. So helping them
Yes.
understand first of all the risks that exist there, and then the steps they can take
Right,
to it. So our work with them has been the kids and are already there. Their families will come when we need to.
right,
So we've held them package high quality single day or multi day sessions where we're discussing asthma as it is, what they can do, and what we
right,
should be doing to improve
right.
outcomes.
Yes, yay. So, yes, you brought up an important point, the physical environment. So, what are things in in the homes, essentially? What are things that parents need to watch out for that could be worsening their child's asthma? I know as a pediatrician, we talk a lot about the smoking, and the parents sometimes don't want to hear about it, but it is important. But it's not just smoke, there's other things too that can trigger asthma. So, can you tell us about that, please?
Oh, sure. So you're right. I am. This list will not be complete if we don't talk about secondhand smoke exposure. So
Right.
that's important, but it's more than that. So um, first of all, in many so mold is something that is
Mm-hmm.
unfortunately quite common, right,
Right.
in many homes.
Right.
In inadequate, poorly built. So many homes have cracks and things that allow moisture in, and so
Right.
that's one thing. Another thing is dust mites.
Mm.
So the kind of carpeting, the kind of curtains, and the kind of bedding that
Right.
makes itself a place where dust mites just accumulate,
Mm-hmm.
it is a higher risk for kids.
Right.
A lot of homes as well have a lot of parents and families use a lot of harsh chemicals to clean,
Right.
right?
Right.
So to clean flooring, to clean clothing, and that becomes risk. A lot of parents also have a lot of fragrances that they
Mm-hmm.
put in diffusing
Right.
equipment, and for different reasons to affect fragrance in their homes, but makes for worse outcomes.
Right.
And so those are now, and not in everyone, but in homes and families with pets, where the kids asthma is affected or worsened by pets, that they
Right.
have to understand how we separate the pet from this living environment, and how
Right.
routine around cleaning. So it's many little things, but the understanding, and then the
Right.
strategy, empowering people to understand first of all what the risks with this is, and then empower them to take action.
Right. So, yes. So, what are the risks with untreated or uncontrolled asthma? So that parents, and whoever is listening can understand why we're actually having this conversation.
Yeah. So the list is long, but essentially, Let's work from many things we've already mentioned. So many kids with asthma, let's start from play. Childhood. Every time I say children, the image that comes to your mind should be a
Right.
child. Children love to play. Children
Right.
and play should be almost synonymous.
Right.
Um, Unfortunately, with poorly controlled asthma, the child is less.
Sorry about that.
No problem. It's
Okay.
less likely to enjoy even playtime.
Right.
The spring season is starting, right? So, but if poorly controlled asthma makes a child less likely to even just be outside playing,
Right.
that affects mental, it improves outcomes with mental health, it
Right.
improves overall experience, right, for children.
Yes.
So, I want to center on the fact that if a child cannot play, just enjoy play,
Right.
that's the problem, right? And then
Because, sorry to interrupt, but because play is so crucial to social emotional development, and that's one of the things we're working on with Kids of Hope is how can we help children through play, but help them boost their social emotional and cognitive development, because play is scientifically proven is absolutely tied to the development of your brain. So that's why play is so important for kids.
absolutely,
Yes.
if we even just stay on play, if we stay,
Right.
I've the number of times when we've heard families say, "I don't let them go outside." I
Okay.
don't let them go outside. They're
Yeah.
essentially part of the treatment for some of the traumas they've experienced, some of the
Mm-hmm.
things that we no longer can change, but we can work to correct and improve, right?
Right.
But if where asthma is excluding a child to something that is therapeutic, like play, right?
Right.
Then it's sad and it's something we should be looking at, right? And
Yes.
then we talked about sports. Uh, Physical activities. Sports has there's many things that kids learn from participating in sports, right?
Right.
So the actual sport itself is enjoyable, but also
Right.
what they learn by team working together in teams. Um,
Mm-hmm.
Things it also makes up sometimes for, like in foster care, things they've not experienced within a normal family structure. They might
Right.
get to experience in sports. So, but again, if asthma is keeping kids from doing that, you know, let's go back to school, right? If
Right.
asthma is making them feel self-conscious, less likely, I know people who say, I cough every other minute, and unfortunately, with the pandemic, a, a
Right.
cough is one of the very synoptic, is
Correct.
very hallmark of poorly controlled asthma. But
Right.
I've had families, I've heard from families and schools that they feel uncomfortable because this child won't stop coughing, right?
Right.
And so because a lot of people are worried about COVID, but it's the poorly controlled asthma. So even
Right.
school is something they can't enjoy. Um,
Right.
and then if you're missed school days, if you're sick so
Mm-hmm.
often and they're telling you to go home, they call families to pick them up. Foster parents who maybe are trying to work or have multiple other kids to care for have to leave
Right.
all that and go pick up this kid. Right.
Right.
And then we're talking about emergency visits, right? And then the not just the disruption to normal life, but also some of the medications we then use to treat those. So we use steroids a lot, right?
Mm-hmm.
Steroids in themselves, I don't want people to, it's not bad, but when you
Right.
have
But.
emergencies, we have to use it in high doses. And if that
Mm-hmm.
happens multiple times in itself, it helps when you need it. But if you need it too much, you start to experience side effects, which are
Right.
in all parts. So, and then the cycle. And unfortunately, the extreme end, which I am sadly I've seen too many times, because even one
Right.
time is too many, is brain injury.
Right.
Patients have had severe episodes that lasted too long before they got access to oxygen or help, and the brain has suffered a permanent damage. And then ultimately,
Right.
sadly, some kids, even before they come in, are dead or die despite
Yes.
everything we try to do. So it
Yeah.
runs the gamut of all the way from play every day through school, through regular activities of daily living, to the ultimate adverse outcome of death if asthma is poorly
Yes.
controlled.
And with with all that we know, that should not be happening,
It should
but
not.
it still is. So it's a call to action for all of us that we do our parts to just keep helping all of us get educated. So how can people, how can schools, how can communities reach out to you that need your services? Because lots of people need your services.
I, yeah. So right now they can reach out to me on LinkedIn, through my LinkedIn. They can send me an email or my an email at kidsbreatheandthrive@gmail.com. We're
Okay,
happy to explore and see where, with schools, with community organizations, what they're experiencing and what they need. And the important thing is that we tailor it to our particular audience. We make sure that we're not um, we make sure that we're not doing something that works just on paper, for
right,
but that it works for their specific communities, right? So
right,
we do a needs assessment. We tailor interventions to where we see the needs are existing,
right,
and then we deliver it for them. We support them through it, to make
right.
sure. So it's a relationship that we're hoping that we can build again where you are, with schools,
Mhm.
with working with school nurses. We've worked with school nurses, with early childhood centers, with
Right,
community organizations, with even some healthcare organizations who are either in remote places and don't have access to easy referral to specialists, or to
yes,
centers that can take care of complex, hard to control asthma.
right. And so, what would you say to parents who live in rural areas, like who don't even have access to who the children's hospitals are far away? It's like, so, like, well, let me rephrase that. How can we empower parents to go into their pediatrician's office and adequately talk about what's actually going on with their kids? Because a lot of times I see parents who they don't know the answers to simple questions like what's your child taking, when was the last time they used the albuterol, and all of those things. What are just some tips you can give parents that these are things they just need to watch out for with their kids who have asthma,
So
so
good,
that
good. Absolutely. So first thing is, I think I like parents to understand
right,
signs of poorly controlled asthma.
right,
So I've heard things like, yeah, the usual cough.
mm-hmm,
So that's it's not usual with that. Some their children are coughing during the day. No
mm-hmm,
child, when when it's not during a respiratory illness, should be coughing through the night or waking up
right,
multiple times. So recognizing signs, when a child, every time they run, sometimes when they cry, sometimes when they laugh, ends
right,
up with a cough, or that spasm, and then you hear parents saying, "Oh, I told him not to push himself too hard." Children are supposed to laugh. They're supposed to
right,
run. They're supposed to play and run, and if they want to. So recognizing first things that they experience that are signs of poor control, and that's a reason to bring it up to
right,
in the doctor's office and say, he's coughing during the night when he's sleeping. During the day, he's
right,
playing with brothers and sisters. He's not able to play in the park, right,
right,
without stopping to have. So recognizing that. The next thing is, and being willing to bring it up. The next
right,
thing is recognizing and listening attentively and asking questions. Sometimes the medications are in inhalers,
right.
and recognizing the ones that are quick relievers, separating them from
That yes,
separating them from the daily control.
yes,
Mastering technique when your tells you how to use it, and the use of spacer devices,
right,
sticking to that, right?
right,
If you've done a particular therapy for a while and the symptoms are the same, it doesn't mean don't go back to the doctor. It doesn't mean don't talk about it. Advocate and say, "Doctor, I tried what you said." Again,
right,
there's so many more options we can offer them, but you need to bring it back.
right,
If things are happening, if children are being called often in school, or you're hearing reports from school nurses and school systems, that's something. if we give them asthma action plans and they don't understand what it means, they should ask us, right? Because I am an advocate for not. It's not enough to just say, "Here, I fill out your asthma action." So many I've seen those forms. Parents don't know what they mean,
Right.
and taking the time to say, "Can you explain what this means to me?" And then when
Yes.
you and then demanding that schools have the support systems and to support their kids with asthma on school
Right.
trips, on a daily, because I know kids have been excluded from school
Right.
trips because of asthma. So
Right.
things like being and understanding what poor control looks like, advocating in the office, understand, asking questions about the different medications, when to use
Right.
this, when not to use this, and also the unfortunately so many misconceptions about asthma medications and asthma
Right.
therapies, and being able
Right.
to bring the questions not on social media, but in the so that's why education is
Yes.
very, very important because even
Yes.
sadly, in many schools and many places, there's a lot of misconceptions about um, these things we do. But so helping
Right.
communities, organizations, schools understand um, the what the right therapies are,
Right.
and and to take the right action. So
Yes, I know. I was. I know. I asked how they could get in touch with you, and then I went right back into questioning. But no, it's so important, parents. I tell all my parents, there's no such thing as a silly question. Please ask. It makes a difference. We don't know what's going on with your kids. You see your kids, so ask, and never be ashamed to ask a question. It can be it can be a matter of life and death for your kid. So please, we sometimes doctors we are rushing, unfortunately, or we may not ask all the questions. So please ask us questions. So I'm gonna show again how you can get in touch with Dr. Shade, and it's that send her an email or follow her on LinkedIn. And thank you so much for your time. Wow, this was such a great conversation. Thank you so much for
same
coming
here.
on.
Thank you, Dr. Echo. Thank you for the excellent work you do. And it was a
Yes.
pleasure talking to you.
Yes, you as well. So, if you'd like to know more about Kids of Hope, here is our information kidsofhope.org. And that's my LinkedIn where you can follow us, or brainpowertv@gmail.com. So, until next time, it's a wonderful pleasure to talk with you and have a wonderful week ahead of you. And please share this with as many people as you think might need to know about asthma and how we can help our kids breathe and thrive. Thank you.
Thanks. Bye.